We've got about 15 folks on the call, so I think, and we're a couple minutes past the hour, so I think we can get started. So, first of all, my name is Jared Leff, and I'm a senior research program manager here at Cherish, based at Weill Cornell in New York City. In this role, I provide administrative and logistical support to Cherish. So, in non-HR terms, I consider myself the glue person for Cherish and to make the trains run on time. So, my role here today is to support the webinar participants as well as connect and introduce you to the head of our pilot grant program and co-director of the Pilot Grant and Training Mentoring Core. With that, I'd like to welcome Dr. Brandon Aden, who's an assistant professor in medicine and population health sciences here at Weill Cornell Medicine. In clinical practice, Dr. Aden provides addiction treatment and primary medical care to patients with substance use disorder. He's also the program director for our addiction medicine training program in New York Presbyterian and has led the Cherish Pilot Grant program since its inception in 2015. Brandon, the floor is yours.
Hello, everyone. Thank you, Jared, for introducing me. So I just wanted to touch base on the purpose of today, just to go over goals or sort of talk about the Cherish Pilot Grant program, a little bit about eligibility and sort of the application process, and then sort of some of the benefits of the program itself. I'll be throwing out a few FAQs throughout the process, sort of questions that people often ask. And then we'll sort of, if you have any questions, we'll have a Q&A session at the end, but if you do have questions during it, you can throw them into the chat, and we'll make sure we get to them at the end as well. So this is our agenda for today. So as I said, I'll do an introduction and sort of overview of the Pilot Grant project, and then we'll do some Q&A with two pilot grantees that we have joining us today, and then we'll have questions at the end as well, time for questions at the end. So at this point, I do want to introduce a couple of the guests we have with us. So Fiona Gispen and Biondi are two of our prior pilot grantees. I'm going to invite them to tell us a little bit about themselves. Fiona, if you want to go first.
Sure. Hi guys, welcome. I'm Fiona. I am currently an instructor in infectious disease at Weill Cornell Medicine. When I got the pilot grant last year, I was a third year infectious disease fellow there. I was in my research year of fellowship. And my project was looking at drug use associated infective endocarditis in people who use drugs. I used nationwide Medicaid data, and plan initially was to do a comparative effectiveness study comparing different types of antibiotics, so IV, oral, and no antibiotics on various health services outcomes like readmissions and mortality. But then kind of during the project, I pivoted more to focusing on patient-directed discharge, which I can talk about more later if you guys want. But basically found that a lot of patients had patient-directed discharge, 20%, and only 15% of them fill antibiotics after discharge. And if they do fill antibiotics, our odds of readmission is much lower than if they don't fill. So this supports a bunch of clinical interventions like providing meds at bedside at the time of discharge. So my project was quite clinical, quite related to infectious diseases, but using national Medicaid data. Yeah, do you want more now?
No,
Right now?
that works. Thank
Later.
you.
Okay, perfect.
Bree, go ahead.
Sure. Hi, everyone. I'm Bree. I'm currently doing a postdoc at U Chicago, and which largely focuses on Medicaid enrollees and MCOs, which is really interesting. But when I received my award in 2024, I was a PhD candidate that was working on my dissertation. And so most of my pilot granting funding funded the data, et cetera, for my dissertation, which looked at postpartum HCV care after the Family's First Coronavirus Response Act. And essentially what this act did was change pregnancy-related Medicaid from 60 days to 1 year postpartum. And I found that after that policy change, treatment for HCV increased, which was really interesting because prior research found that just among everyone with HCV, treatment declined, especially because that was during COVID times. Um, and yeah, I'm just excited to be here and talk about my experience.
All right. Thank you very much. All right. So just to give everybody a little bit of an overview of CHERISH. So CHERISH is a Center for Health Economics of Treatment Interventions for Substance Use Disorder, HCV, and HIV. It's a NIDA-funded collaborative center across multiple institutions. So Weill Cornell Medicine, Boston Medical Center, Boston University School of Public Health, Penn LDI, and University of Miami's Miller School of Medicine. And then this year, we also added two additional school team members at different universities, the University of Connecticut and NYU. So a little bit about our overall mission. So CHERISH specializes in developing and disseminating economic research around substance use disorder and then comorbid conditions of HCV and HIV in people who use substances. It covers topics ranging from healthcare utilization, health outcomes, health related behaviors as well. So it's a fairly broad sort of mission. A little bit about our research. So our research, as I mentioned, focused on substance use disorder, intervention for substance use disorder, and HIV and HCV. We use a combination of methodologies. So we have people who work on simulation modeling, economic evaluation. You heard from Fiona and Bree, some of their work as well. So it's sort of a broad portfolio that falls under CHERISH. A little bit more about what we do. So in addition to our research that is within the center, we also have what's called our consultation service. So this is a service available to anybody. You can submit a request and they will provide consultation to help you anywhere from developing sort of a grant application, grant proposal, to sort of working on analysis that you sort of work through your research. So it's a fairly broad scope that they can assist you in. It provides up to 6 hours of free consultation service time for that. And then potentially can go on to develop relationships. So a lot of people who do consultations actually develop more formal collaborations with the people they do their consult with. We also have our pilot grant, which is what we're going to be talking about today. We do provide some trainings as well and have online resources. So we have some training modules that are online on our website that you can go to. And then we do some additional sort of online or in-person trainings throughout the year. So today we're here to talk about the pilot grant program itself. So the CHERISH pilot grant is an annual grant. It's a one-year grant, up to $20,000 in funds to support investigators who are conducting research in health economics around substance use and then HCV and HIV in these areas as well. It is open to anybody in the country. This year we plan to award 3 pilot grants. And I wanted to talk a little bit about the eligibility. So this is the eligibility criteria you'll see. So it's pretty open to anybody, but our CHERISH researchers, that includes our investigators, internal investigators, research affiliates, and our center advisory board. It's also open to postdocs and trainees who work with any of our CHERISH researchers. And then, as I said, it's open to anybody, so any investigator in the country. So there is this caveat that says you have to be nominated by a researcher at CHERISH. So if you're not affiliated with CHERISH in any way, shape, or form at this point, don't have any connections to us, we will sort of help you identify somebody who's a CHERISH researcher who can be your sponsor and sort of help you through this process. So if you don't have one, don't worry about that. That's something we can sort of help you with. A couple of frequently asked questions at this point is if you're a PhD student, are you eligible to apply? As Bree mentioned, she applied while she was still doing her postdoc. Yes, you can, or during her doctoral. You can still apply as a PI during your doctoral program. The only caveat is this is usually a sub contract with your institution. So assuming your institution lets you be a PI as a postdoc, we're fine, or as a doctoral student, we're fine with that. If you're a master's student, unfortunately, you would not be eligible to be the PI for this CHERISH pilot. But if you're working with a team where somebody might fit the criteria, then they could be the PI and you could still be part of a team potentially to work on a pilot grant. The other question often asked is if you already have a K grant. Whoa, I went way far. If you already have a K award, are you eligible to apply for this as well? The answer is yes. There's some, because they're both often NIDA or NIH funds. We just have to be careful that there's no overlap in the funding support. So we just be clear about what the pilot grant is going to be funding versus what your K grant is sort of supporting. But yes, you can have both of these as well. At this point, I did just want to touch base with Fiona and Bree and talk to them about your Cherish sponsor for your projects, how you met them, and then sort of how they were involved in the process of your applications.
Sure, I can go first. So my sponsor was actually my mentor throughout my fellowship. It is Shashi Kapadia, who was an assistant professor in the Department of Population Health Sciences and Division of Infectious Diseases at Cornell. He'd actually been a previous recipient of the Cherish Pilot Award, and he continues to work here at Cornell, working a lot with this team actually. So he was super helpful in my application, and I worked really closely with him on kind of both solidifying my idea, my aims, and then also putting together the grant application. I didn't and don't still have a K, and I actually hadn't ever done a grant application prior to this, so I really learned a lot throughout this process, and Shashi was really invaluable. I was lucky that he had a lot of experience with this grant previously.
Similar to Fiona, I had already knew my sponsor and worked with her previously. My sponsor was Dr. Rachel Epstein. Um, and yeah, she was already a part of my dissertation committee, and I had met her years prior, and we'd been working on a handful of projects together. So yeah, she was also just like heavily invested in just helping me write the grant, make edits, etc. But also alongside my other committee members. So it's kind of nice having a handful of mentors help me with everything.
Great, thank you. As I mentioned earlier, for those of you who may not have any connection to Cherish at this point, we will help you make a connection if you don't have one. So we'll provide that contact to give you a Cherish research mentor um, uh, for nomination for this if you don't have one. All right. So now we're going to talk a little bit about sort of the structure of the pilot grant. So a little bit of the timeline. So letters of intent are due in January, January 9th, and then the proposals will be submitted at the end of February, February 20th, and then March, April is when we do our internal review process and then select the pilot grants that will be funded, and then we'll do the notice of awards in early May. So the LOIs are the first smart. Let me go to this part. Yeah. So the LOIs, as I said, are due in early January. The LOIs, this is sort of the structure of what we want in the LOIs. So it's a little bit about yourself and then sort of a broad overview of the project itself. And then a little bit about who the researchers are and co-investigators. A couple reasons that we do this is one, we use this to sort of figure out if your project is in line with Cherish, and then if it is in line with Cherish, if you maybe need to make any edits or changes to it. And then the other purpose of this is sort of helps us start thinking about who are going to be reviewers for your pilot grant. If you submit an LI, it does not mean you have to submit an application, just so you know. So feel free to submit an LOI even if you're not positive that you're going to submit an application, and we'll still go over and sort of give you any feedback and that sort of thing. After you submit your LOI, we will give you notice of one of three things will happen. One will tell you immediately, yep, you're good to go. Go ahead and move forward with the application if we think it's good and fitting with Cherish. The other one may be that after reviewing your LOI, we think you may need to make some changes or tweaks just to make it fit with Cherish or make it more likely to get funded. Or third, if we review it and we feel like it's not in line with Cherish's overall mission or is unlikely to get funded, we will give you that feedback as well and suggest that you probably either change ideas pretty drastically or not proceed with the actual submission of the application. For the actual application, so the application is very similar to a normal NIH grant application format. The structure is pretty the same. The only difference is the amount of space that you get for the science. Most of these details are also on our website about the overall format of the application. And then when you have submitted your application, you will email it to us at our pilot.grants email for Cherish Research. But it does follow NIH format pretty well. So as Fiona mentioned, if you've never had any experience submitting an application before, it is sort of a good way to sort of learn about that process and get an idea of how that works before you sort of do more formal, bigger application to NIH or other organizations. This year, we do have a special topic of interest. So we are looking at substance use disorder and comorbid conditions. So other comorbid conditions, including medical conditions like chronic pain, cancer, heart disease, or other infectious diseases, similar to what Fiona did, or other mental health disorders as well, so PTSD, etc. This is our call for a special topic this year, but your application does not have to fit this call. So if you have an application or an idea that's not going to meet the one of these comorbid conditions, that's fine. As long as it fits within CHERISH overall mission, we're okay with that, but you don't need to necessarily specifically address this. After you submit your application, we will do the review. As I said, we have April into March. April, we do our internal review. We use the NIH review process. So again, if you're sort of early in your career and sort of doing applications, this will give you an idea of how that review process works for NIH. So you'll get an idea of what they're looking for and how this goes. The NIH did change their review process about a year ago or so. So it's a little simpler than it used to be. So now there are three factors. So they took what used to be multiple domains and sort of condensed them. The first factor is looking at the importance of the research. So this is what used to be significance and innovation. So how significant is this research? Does it answer a specific project or a specific question that is important in the field? Any innovation? Is this a new methodology? Is it going to change or change interventions or within the field as well? Factor two is rigor and feasibility, which used to be approach. So this is looking at the overall strategy, methodologies, analysis of the project. Is this sort of well developed and well designed to answer the specific aims of the project? And then factor three, expertise and resources. This was used to be broken down into investigator environment. And so this one has much less weighted than it used to be historically. So the main criteria is actually now the importance of the research and the rigor and feasibility when deciding about funding. And then the other subject sections are typical. So human subjects. So you can sort of review if you have human subjects, then what is needed, and then the budget for that overall project as well. How you decide to spend your money is pretty broad. So as long as the costs are allowable by NIH, we're pretty open to how you spend the money. Prior grantees have spent it on a broad range of things. So common ones are data acquisition and time and effort. So that may be your time, but it may also be time of a research assistant or an analyst if you need that. Probably grantees often use this also for open access to feed journals, conference travels, participant incentives, transcription, translation services. This isn't a be-all end-all list. If you have other ideas or other things you need to spend money on, as I said, as long as it fits within an allowable cost by NIH, we're pretty open to that. At this point, I was just going to ask Fiona and Bree if you could talk a little bit about how you spent your funding for your project, and if you had any changes as you during your project, if you had to reallocate how your funding was spent.
Sure. Yeah, so I was again on this NIH T32 research grant while I had the Cherish grant. So I didn't allocate any funding from my time. However, I did have a research analyst who was helping, and so we paid, I think, like 10% of his time through the grant. And then I also budgeted some for publication fees, conference registration and travel. I went to ID Week this last year, and I think that's it. And then my budget did not really change. My allocation didn't change throughout the project.
Okay.
I had to pay for data for my dissertation, so a large part of my budget was used for data acquisition, and then because I wasn't funded for the fifth year of my PhD, I used some of my Cherish granting to fund me. And then I think I also allocated just like some technology random budget. And during that time, my laptop battery died. So I used my Cherish grant to get a new laptop battery so I could actually finish my work. Um, But other than that, like nothing too exciting. I think like I did put in conference fees and travel, but I didn't get a chance to actually do any of that. So
Okay. Uh, occasionally during the process of your pilot grants, you may need to reallocate funding as well, and that is something that we're open to. We just talk about that during the process, but occasionally that happens for various reasons. All right. Next, I did want to touch a little bit about our communications team. So Bonnie Shea is on the call with us. So she is our communications director. Or communications manager, I guess, is technically her title, that works with us. So she is the communications manager for Cherish and oversees all of our communications on various platforms, but she will also works with our pilot grantees. I'll let her tell us a little bit about herself and that experience.
Hey everyone. Thank you, Brandon. Yes, so I am in charge of the public facing kind of materials, presentations related to Cherish research. And so one of the primary ways that I support grantees, first and foremost, is to write a profile feature to within like 2-ish months after the grant has been awarded. It's one of our well-read features on our site. But also one of the fun things to write as a way for me to get to know grantees and the research that they're doing. And the communication support continues even after the 1 year grant period because the work takes time um, to maybe perhaps get a publication or there might be a conference related to the pilot award that will then be funneled to me, and then I will add it to our editorial calendar. And so I'll work my way through and um, assign it to our newsletter, our social pages, or our website. Um, and I'll just drop a couple of articles that I've written recently highlighting some recent pilot grant work. And um, yeah, and that's it for me. I hope to connect with you all in the future.
Thank you very much. So, as Bonnie mentioned, if you're awarded a pilot grant early in after your award, you'll interface with her. She'll do a little bit of bio sketch on you, a little bit of background about your project, and do the publication. And then during the process of your pilot grant, as you progress and you have publications, et cetera, she'll help sort of disseminate that information. The other part of the pilot grant that we focus on is helping pilot grantees get their information and their research out there. So we do also have a dissemination training that is led by our dissemination and policy core at LDI, which is led by Zach Mizell and Maggie Lowenstein. So there's a training about halfway through the pilot grantee year, which is focused on sort of dissemination of your research in sort of non-traditional ways. So thinking about news, op-eds, that sort of thing. So ways to get your information and target your information to people not necessarily in academia. So if you're trying to reach policymakers, that sort of thing as well. So it's sort of focused on that, which is a good skill to learn, not just for your pilot grant, but sort of thinking about your career in general. In addition to that, we also have quarterly check-ins between Jared, myself, and the pilot grantees, and then some of our other leadership at Cherish will meet with you during that time as well, which one will sort of talk about how you're doing on your pilot grant as well, but also there's some focus on career development, depending where you are in your career and what you're thinking about applying for K grants, maybe going on the job market, that sort of thing. So there's some other sort of things that go along with that. A few of the things we do track during the course of your pilot grants are any publications that you might have, so manuscripts, conference presentations, if it leads to any subsequent grants, your pilot grant does, and any non-traditional sort of publications, so op-eds, opinion pieces, that sort of thing. And then some soft skills or soft outcomes that hopefully you develop that we like to see is any new skills you may develop. A lot of times pilot grantees develop collaborations or networks networking through Cherish because of the pilot grant, and that goes on to additional research during their career, and then any mentorship or training as well. At this point, I was going to ask Fiona and Bree also to mention a little bit about your the outcomes of your projects. So any publications, conference presentations, that sort of thing.
Sure. So I presented an abstract at ID Week about 1.5 months ago on kind of what I mentioned before, the correlation between patient-directed discharge, antibiotic fills, readmissions, and mortality in Medicaid recipients. And that was fun, went really well. And then I also, let's see, presented that same thing as a poster presentation here at an internal Cornell conference. And then I am almost done with my manuscript, and so planning to submit that to an infectious disease journal within the next 2 weeks or so, hopefully. And then I'm also currently applying for a K award and then two internal kind of pre-K awards that we have. And I'm definitely using the experience and the skills that I gained during the Cherish period as support for my grant applications. And then in terms of some of the soft outcomes, we had a mid-year presentation and then an end of the year presentation, and I met kind of multiple people who are outside of our institution who share my interests, and it was really good to meet them and chat with them about future ideas. And so hopefully I'll continue staying in touch with them and maybe collaborating with them in the future.
For me, my first goal was finishing my dissertation. So that got done in July, which is very exciting. And then I'm currently working on submitting manuscripts and applying to conference presentations and hopefully submitting my first dissertation paper by the end of this year. So things are moving along, but they definitely move along a lot slower than anticipated.
Yeah,
Um,
that's not uncommon.
yeah. As for soft skills, um, I think working with people like Bonnie to really get your work out there is like a super helpful skill to have. And then specifically with Rachel on other projects, we worked with like different news groups and whatever, just to kind of learn how to do that and really promote your work, I thought was really, really helpful. Um, yeah, I think it's hard to quantify soft skills
No, no,
sometimes, but
yeah,
yeah,
that's
there are
fine.
a lot of meetings with Brandon and Jared, and they're just like super helpful. Um, yeah.
All right, thank you.
And maybe I'll ask a leading question to Fiona real quick, but had you used Medicaid data before this project?
No, I had not. So I really kind of learned how to. I'm very comfortable with it now. Had a lot of support from my mentor and our data analyst, and I'm hoping to continue to use kind of Medicaid data analysis in my K award and future grant applications. So that was a huge plus.
Great, thank you. Okay, so just a little bit for everybody to know, after your pilot grant, it's not necessarily over, our relationship with you. So often our former pilot grantees will join our mentee program. So we have a mentee program that is led by UA Bao. And then we also have our affiliate program. So some of our pilot grantees have gone on to be Cherish affiliates. And as Fiona and Bree mentioned, their mentors were prior pilot grantees as well. So often our pilot grantees go on to mentor subsequent pilot grantees. Um, so just a little bit, oops. Um, just a little bit about the mentee program. So that is a 1-year program that, as I mentioned, Yuha Bao runs. It is an informal program that meets monthly. Every other month is sort of a cohort of people who are early in their research careers, and they sort of work together and present their projects and sort of discuss their research within their group. And then the opposite month, we have presentations by people to help people in career development. It's really focused on career development and early research development. And then we have a research affiliate program, which is like almost 10 years old at this point, 8, 9 years old at this point, which is a group of people around the country who are working in this field. And sort of it's a nice network of people around the field. And so it's an easy way to network with other people as well. And you can go on our website and see a lot of these people who are in our affiliate program as well. All right. So that is the end of the sort of formal presentation part of today. At this point, we are going to open up a Q&A. So if you have any questions for either myself or Fiona or Bree, at this point, please go ahead. I wasn't monitoring the chat, so I don't know if there were any questions in the chat. Jared, if you want to throw
Nothing in the chat yet.
Okay. All right. So feel free to call them out, or you can put questions in the chat if you want as well. Either way is fine.
Hi, I do have a question.
Yes, go ahead.
Actually, sent it to you, Brandon, and the private direct message, but I can like read it.
Oh, sorry.
Yeah, thank you for this workshop. And so I'm a PhD student at Penn State, toward like kind of finalizing my PhD, looking forward to kind of finish around late summer, like or next fall of
Okay.
2026. So like according to the time plan of the grant, there might be a period, I think similar to Bree, like where I'll be kind of transitioning between like concluding the PhD and probably starting something afterwards, a job
Yeah.
or a postdoc. So I just want to confirm in this case, if I apply and have Penn State, my kind of administrator or the grant administrator, I should be fine, right?
Yeah, so whatever institutions you're at is now is fine. We've had that happen before where postdoc or doctoral students applied at the end of their doctoral program and then went on to do their postdoc at a different institution. So if you're selected, we'll work with you to figure that out. So depending on the timing, sometimes we just wait till you get to the new institution to execute the sub-award contract. If you're going to be at your current institution for a while, we may initiate your program and then do a separate one when you transition.
Oh, so you kind of transfer at midway, halfway or something like that.
Yeah, it just depends on the timing of where you are. So if you're going to start your postdoc like in like August or September, we would probably just wait till you get the new institution because executing the subcontract takes a little bit while, and so it's not necessarily worth the effort. But it sort of depends. But we'd work with you individually to figure that out. But yeah, you can apply with the program you're at, the institution you're at now.
Yeah, and I just want to say hi, Bree. We've met like last year in CHERISH modeling meeting. So yeah, it's nice. Congrats on concluding your PhD. It's nice to see you kind of progress.
Thank you.
Well, first of all, my name is Chenglin. I'm assistant professor of social work at UConn. So, it's great to hear that Connecticut is being included in this. So one of my questions related to that is, first of all, I don't have a mentor or anticipated mentor yet.
Okay.
And I know that there is a timeline that is encouraged for the applicant to submit. So, probably Cherish can pair me or, the applicant with a potential one. First of all, is there a preference that you should have your mentor in the same institution? And the second is just, for the scope of the, like the timeline of the grant, as well as, the scope of the funding, is there a preference on whether you should prioritize secondary or existing data analysis versus collect your own data?
So there's not a preference on the project. So yes, it is a 1-year timeline. So I'll start with the mentor thing first. So you don't have to have a mentor in your institution. If you don't currently have a mentor, please feel free to email us and reach out to us. You can reach out to us before you submit the LOI, and we can sort of try to help you connect with somebody. I saw in the chat that somebody prior had emailed this, and I don't know that I've seen that email. I don't know if you saw it, Jared. Um, so if you have emailed us and we haven't responded to you, please feel free to reach out to us directly as well. Because I don't think I saw that email. But you can email us early, and then we can sort of figure that out and sort of help you identify and mentor before. You can still submit your LOI, even if we haven't identified that person yet. You can still feel free to submit your LOI. As far as your project, we do not have a preference about what you're going to do with your data, whether it's going to be primary data or secondary data. And some people have done primary data, so they've done, survey, patient surveys, et cetera. And then a lot of people do secondary data. Part of that is just because of the time frame, so it does need to be realistic. So if you're going to be doing primary data collection for whatever your purpose is, you still want to make it realistic that you can do that data collection and have sort of address your aims within the time frame. We get that it's only a 1 year time period, and so often this takes longer than that. Like it carries over, and so it'll go beyond that. And so we're completely aware of that. But if you submit an application where you're like, we're going to collect primary data and analysis, and you expect that to take 2 or 3 years, it's unlikely to get funded. But if we're going to do the primary data collection in the first like 8 to 9 months, and then maybe the data analysis is going to carry over, that's fine. So yeah, we don't have a preference about that. It just has to be realistic that it's going to be in the time frame or relatively within the time frame.
Going off that, I would say just be ready to hit the ground running as soon as you get your notice of award.
Yeah.
And I was super ready and struggled to still get my data. I got my data from Trinetics, which essentially is electronic health record data from institutions across the United States. And like we had everything we thought all the way worked out with them, and it still took them like months
Yeah.
to get my data. So yeah, I would say just like prepare.
Yeah, so even with secondary data, there are often like hiccups, delays, getting the data, et cetera. So it doesn't necessarily mean it's going to be faster when you use secondary data. If you already have access to the data, that's one thing, but if you're going to have to get access, then yeah. I did have a couple of questions I was going to ask Fiona and Bree. So Bree, you already sort of mentioned your sort of advice, be ready to hit the ground running. But is there any other sort of piece of advice you would give to the applicants as they're thinking about their projects?
Yeah, I think there was like a lot of back and forth with BU about my budget, and it was very, very confusing. So I would say to probably work close with your institution about like what they will allow versus not allow. Like Cherish seems to be very flexible. They were with me, but then like BU had a bunch of different things. So yeah, I'd say like work with your institution on budget.
And I think I was particularly lucky that I was at Cornell, and a lot of this is based at Cornell, so I didn't have quite as much difficulty with the budget and with the kind of administrative things. But I would say really try to, once you find a mentor, really take advantage of your mentor and work really very closely with them to put together your application. Um, and then pay attention, I think, particularly to the relevance section, and try to really mirror the either special topics or the NIH priorities. That was very helpful for me in putting together my application. And then also like really try to take advantage of the network, particularly at those mid-year and then final year meetings, because I think that you can really, really get a lot out of that in terms of your career going forward.
Yeah, I for a lot of people who apply to our pilot grants, is their sort of first to go at ever doing this process, and so um, there is a steep learning curve, I think, for a lot of applicants, both in the application process and sort of, as they mentioned, the budgeting and sort of working through all that sort of stuff, which we completely understand. And we'll work with people to help work through that process as well if you're selected. So, even after awards, there can be issues with the pilot grants and subcontracts and blah, 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 blah. So it is a learning opportunity, though, particularly for people who are early in their career. So if you've never done this, I think that's sort of one of the nice things about the project, pilot grants. Does anybody else have any other questions?
There's one in the chat, Brandon.
You mentioned earlier there's a preference this year for proposals for economic focused proposals, but the application do not have a limit to this topic. How has previous projects supported dissemination science focused proposals? So one of our cores is dissemination science. So as long as the focus is still CHERISH's overall mission, so you're looking at health outcomes, et cetera, and how you're going to disseminate that, that's fine. So it doesn't necessarily have to be an health econ evaluation for CHERISH. If you have specific questions about a project you're thinking on, you can reach out to us individually, and we can sort of work our way through that. But as long as overall is still related to substance use, HOA, HCV, and one of our cores is dissemination focus. So we can talk about that individually if there's questions specifically about your project, which may be easier because it's fairly broad dissemination science, but yeah. Do you have anything else, Jared, that you want to talk about?
Yeah, I just put a link in the chat to a quick feedback form. So if folks get a chance, please let us know how we did and if there's anything we can do to improve as we try to offer this webinar every year when we have a pilot grant program. And then after we're done today, I will make sure to send around the slides. And then later this week, we'll also send around a copy of a recording of today's presentation.
Yeah, and if you know anybody who couldn't attend today, please feel free to forward the slides and that information onto them as well. Um, uh, as I mentioned, I know I saw in the chat that somebody did try to email us, and I don't think I saw that test.
And Brandon, I just forwarded that
Oh,
correspondence.
did you? Okay. All right. We will get back to you then. I must have missed that email somewhere, but we'll get back to you. But if you do email us and we don't reach out to you, you can also find my direct email, which is BRA2002 at med.cornell.edu. So you can email me directly. And unfortunately, occasionally our Pally Grant email gets sidelined.
Yeah, not to say the dog ate the homework, but we did get a more advanced spam control. And
Yeah, the spam sometimes spams people who aren't actually spam, unfortunately. So yes, please feel free to here, let me put my email in the chat if you want to email me directly if you don't hear from us. Okay. If there are no further questions, then we'll go ahead and end a little bit early today.
Thanks to our speakers and for everyone for joining.